8:07. Campaigners seeking to prevent the closure of Poole A&E and maternity unit and hundreds of hospital beds in Dorset are celebrating after the Dorset Health Scrutiny Committee voted to refer the plans to the Health Secretary. The group Defend Dorset Nhs has had support from a number of local authorities, including Purbeck District, Swanage Town and Weymouth and Portland Borough Councils. The CCG has said it will press ahead with its clinical services review. This was the moment the decision was announced in Committee Room 2 at County Hall yesterday.
Therefore, the recommendation not to refer is lost, and so the Clinical Commissioning Group's proposals stand referred to the Secretary of State.
Well, amongst that group celebrating yesterday, someone who's campaigned hard on the issue is Debby Monkhouse from Defend Dorset Nhs, and she joins us now. Morning, Debbie.
Morning, Pat.
How are you feeling the day after that all happened?
Well, I'm still delighted. It's obviously been quite a long slog, but I'm delighted because it would be, just to put it in perspective for people perhaps more in the west of the county, if Poole A&E goes, the major emergency hospital services will be at Bournemouth. So there will be some things whereby people won't be taken to Dorset, they will be taken to Bournemouth, and it's a very long way. And in a maternity emergency, the neonatal, that's the newborns who need intensive or high dependency care, that unit will move from Poole to Bournemouth. That's a very long way for a mum in a maternity emergency to go. And as you may know, unfortunately, the unit at Dorset County was downgraded by the CCG, the Special Care Baby Unit, about 18 months ago. So it affects us all. There's also capacity issues. Poole saw 68,000 people last year and 37,500 were admitted. Where are those people going to go? So it really does affect everyone. And also we were concerned about the beds. We're concerned about the loss of acute beds. Poole and Bournemouth every year, I don't know about Dorset County, I haven't looked into it, but Poole and Bournemouth every year they stop planned ops because they haven't got enough beds for people coming in through A&E. So the loss of acute beds seems mad. And then of course we've got the community hospitals. This whole plan is based on the idea that there are going to be services close to home and people won't need A&E and NHS beds. But where we see no evidence of any services closer to home, what are they, how they will be funded, how they'll be staffed, we see beds closing all around us. The Portland beds, 16 beds went in August. At Ferndown on the east of the county, 22 beds were closed in September. These are the community hospitals. And at Wareham Community Hospital, 16 beds are closing this month.
So you've made all these points, Debbie, as part of your campaign. Oh, I know, and there are points that, well, this is what you've been campaigning on, so it's definitely worth hearing again. And we heard the reaction in the committee room yesterday to the decision to refer upwards to the Secretary of State, which for your campaign is obviously a positive step, but it doesn't sign anything off particularly, does it? It doesn't get you that much closer because we can't really judge which way he's going to go on it, or what's your feeling about it anyway?
Well, this is, if you like, the process that the local authority can use and really should have used, from when the CCG decisions were first announced last September, it should have been referred immediately by Dorset Health Scrutiny, because the criteria for referral is that the plans aren't in the interests of the residents of the area, and losing 4 community hospitals and access to trauma A&E, we've got trauma access to Poole A&E for Swanage residents and access to specialist maternity for many residents in the west of Dorset is clearly not in the interests of Dorset County Council residents.
And you've maintained, Debbie, that 396 lives would be at risk as a result of longer journey times, and you outlined some of that there. When the result was announced yesterday, our Dorset political reporter Tristan Pascoe spoke to Tim Goodson, who's the chief officer of the CCG, the Clinical Commissioning Group, and suggested it was that risk of harm that appeared to have swung the committee's minds in favour of referring the plans to the Secretary of State. Just for a moment, let's hear hear what Tim Goodson had to say.
So the Ambulance Trust didn't conclude that. That's an interpretation that the campaign group is putting on it. The Ambulance Trust support the proposals that we've done. We asked them, could we go further? How much could we actually get down some of the travel times and the certainty on this? And we got to within 0.6%, which we described as a minimal risk, and that was supported by the judge and the judicial review on that. And that was where they were unsure. So they didn't say it was increasing risk. They said that we were unsure on these areas.
So Tim Goodson says the stats back up, actually, the longer travel times is a minimal effect, so to speak. How would you react to that?
I mean, this is, lies, damn lies and statistics. 0.6% is 300 and basically 0.6%, they looked at it over 4 months. 0.6% is 132 people at risk over 4 months. That is 396 people at risk over a year. And actually, because we're privy to the court papers, and, the CCG seems to be relying on the fact that we may not share certain documents, but the CCG calculated for the court that 132 lives would be at risk over a 4-month period. Well, what they said, there was a risk of further harm. The Ambulance Trust report called for more work to establish how bad that risk was for those 132 people. They've never done it. They've never done the work. So I've paid more attention to risk than the CCG has, because I've actually sat down with a Dorset A&E doctor with the Ambulance Trust report and gone through it, because it actually lists Dorset people who arrived at Poole by ambulance last year, and it asks the question, what would have happened to these people if Poole A&E and maternity wasn't there? And it gives specific details of how bad the situation they're in is. So it's quite easy for an A&E doctor to look through the sample cases listed and say this person is, within minutes of dying, and any longer journey is potentially fatal for them. And that's what the Dorset A&E doctor did. The CCG did ask the clinicians to look at it. We know this from the court papers, but the clinicians asked for more time and access to the patient's hospital records. Basically, the clinicians were being asked on the 31st of August last year to sign off on the risk without all the evidence they needed, in time for the CCG to publish the decision-making business case on the 1st of September. That was what happened. When they didn't get the outcome that they wanted, they just abandoned investigating the risk. I mean, it's ludicrous. Any well-paid public body, if it's proposing things that are going to have a negative impact, needs to properly look into and quantify that impact and say what they're going to do to mitigate it. But because
so, Debbie, what's going to happen next in the campaign? Because you've still got an application in to the Court of Appeal as all that's going on while that referral goes on. What are you hopeful to get from that?
Well, the thing, they look at two different areas. The application to the Court of Appeal, we're waiting to hear whether we'll get permission to appeal. We may not get it, and we may wait a long time to find out either way. That process is looking at, did the CCG give their board who made the decisions the important and relevant information that they had? And the answer to that question is no, they didn't. They knew from the Ambulance Trust report in August about the 396 potential harm, but they did not mention this to their board. So that, in a nutshell, is the core of that argument.
Debbie, we have to leave it there for time reasons. Thank you very much for coming on, and we'll be following the story, of course.
Thank you. Thank you.
That's Debbie Woodhouse, who was part of the campaign group, as you've been hearing about, and at that decision yesterday to refer the changes in Dorset's commissioning of care up to the Secretary of State. I suspect we're going to be hearing more about that. Debbie from Defend Dorset NHS. This is Breakfast in Dorset. 16 minutes past 8, and these are the headlines you've heard a moment ago. Campaigners seeking to prevent the closure of Poole A&E and maternity unit in Dorset are celebrating after the county's Health Scrutiny Committee voted to refer the plans to the Health Secretary.